Good afternoon. It is great to see y'all. I'm really quite impressed. There's so many people here today for this hearing. We are excited and ready to get started. So I will call us to order. First of all, I'm Katie Dempsey. I'm going to let everybody take just a minute and introduce themselves that's on the committee just real quick, because I know we have a couple of new people here, and I'm going to get, first of all, to my left is Amber, who actually makes this show work. So just know that. Amber Mack with House Budget Office. I'm going to try to punch the buttons as we go and just let y'all, we'll go down this way and then we'll come right down there, okay?
Oh, I thought Amber was going to. I'm Karen Mathiak. I represent District 74, which is a piece of Henry County, Spalding County, and Fayette County.
Hi, I'm Stephen Sains. I'm the representative for District 180, the beautiful coastline of Georgia from Cumberland to on top Jekyll Island.
I'm State Representative Mike Cameron, and I represent District 1, which is northern, western, and southern Walker counties, and all of Dade County, aka the independent state of Dade.
Hey, I'm Representative Victor Anderson with District 10. I'm on the other upper corner of the state, Habersham and Rabun counties.
And I'm Representative Matt Barton from District 5 up in Gordon County and Floyd County.
I'm Mary Margaret Oliver, House District 82, middle of DeKalb.
I'm Terry Anelowitz, House District 42, which is entirely in Cobb County.
Thank you, Madam Chairman. Representative Emery Donahue, District 31, which is Hall County and Jackson County. It's a pleasure to serve the people.
Wow, that's the hardest thing that I think anybody does up here, actually, is manage these microphones. But anyway, before we get started, I want to call on Chairman Mathiak to begin with prayer.
Thank you, Madam Chair. If everybody will bow their heads. Dear Father, I just thank you for this day that you've provided and all the good things that have happened thus far. We look forward to hearing your people, to give us great information, for us to be able to spend your money wisely. We ask that you help us to hear wisely and make wise decisions. In your precious Son's name, amen.
Amen. Thank you. So now it's time for all of us to take a deep breath and begin this process. We will start off, first of all, with Commissioner Tanner from the Department of Behavioral Health and Developmental Disabilities. Good afternoon.
Good afternoon, Madam Chair, members of the committee. Thank you for having me. All right, we'll go ahead and get started with the amended FY 2024 adjustments. You see here in front of you the one-time salary adjustment that the governor has given to all state employees, full-time benefit eligible employees at $1,000 for a total of just over $9.8 million for our agency. You'll also see on the next line item the transfer of $7,610,761 to direct care support services to align with budget expenditures. This is transfers from various departments within our organization to help offset the next line item, which is a large expenditure of just under $60 million, and this is in your tracking document 15.11.2. And these dollars are to be able to provide much needed services around at our hospitals. We'll talk in a little bit more detail about some of those items as we go through the budget presentation. As you know, our hospitals are quite old and are in need of a great deal of repair. I wanted, this is a little unusual picture for a budget, but I wanted to share with you how important the investment that you have made in our employees is. I want to express how important the investment that Governor Kemp through the $1,000 has made in our employees. Those are the individuals like here in this photograph at the Atlanta Hospital where the rubber meets the road. They're the ones doing the hard work every day. I've said since taking this job that we have a lot of angels working for our agency, and we do. I knew that DBHDD was an outstanding organization. I knew the state had some tremendous employees, but now that I'm have the ability to run this agency, I have been amazed at what quality of a staff that we have. So I just wanted to give a shout out to the employees and a shout out to this committee for all the work and investing in these employees over the years. So thank you. So one of the things when I was having conversations with OPB during last year's budget cycle, my first year in this role, one of the things that I pointed out was there had not been a significant investment, an adequate investment in the infrastructure at our hospitals. We have a great deal we have over 239 buildings spanning over 856 acres of property around the state. So most of our campuses are over 50 years old. Most of our buildings are over 50 years old. I know Chair Lady Dempsey has had the pleasure of visiting our hospitals, so she knows firsthand how old our buildings are. And with that age comes a great deal of maintenance. But one of the things that I discovered quickly is we really didn't know exactly what the issues were, and we didn't have a clear plan of what needed to be fixed. So we worked in conjunction with the Georgia Building Authority, and they brought on a third party who they had used at the Department of Corrections and some other state facilities, and they did a complete assessment of every building we have in our inventory. And this was a third party with another state agency. We were involved from a standpoint of escorting them and showing them our facilities, but this was very much an unbiased opinion of what they found. And so the report is out, and that showed that we had a total need of $87,979,474. And some of the items are listed there: HVAC, roofs, floors, windows, door replacements, remediation of water and drainage damage and issues, the replacement of drain lines, sewer lines, and freshwater lines. So a large expenditure. So the governor has placed in his budget to the General Assembly just under $60 million in this area, and all of those dollars will go toward remediating the items shown in this report by the Georgia Building Authority. So we're extremely thankful for that. Appreciate the governor, and we hope that this body will see fit to keep those dollars intact. One item that did not make it in to the governor's budget, but we had received some communication from this committee, asked us to talk about some specific things, so I want to mention this. Again, some of you have visited our hospitals. I know Chair Lady Dempsey has saw the treatment malls that we have, and we only have one hospital that currently does not have a treatment mall in place, and that's at Augusta. So we are asking and did ask that we be able to construct that treatment mall. Now, I had a legislator ask me one time, is a treatment mall a place that your patients get to go shop in? And that's not what a treatment mall is. A treatment mall is a place of treatment. And traditionally, our patients received their treatment in the unit they were housed. The treatment mall allows them to leave their unit and go to a special place of treatment. The pictures you see in front of you is Atlanta Hospital, and it is a place where they do art therapy, music therapy. They have the ability to do dances and events. It's a very special place. If you've not had the opportunity to visit one, I encourage you to do so, and we'd be glad to set that up. But the treatment mall allows for us to treat individuals and help them get to a place of recovery in a much more effective way. So Dr. Risby, who is our Chief Medical Officer at the department, really believes in this, and it is paying dividends at all of our other 4 hospitals.
If I could interrupt you for just 1 minute. We have so many guests that are standing up. I want y'all to know you can come in and take some seats. We'll all think better. If y'all will sit down, it'll help us as well. So please come in and have a seat in the room. Unless you really just don't want to, okay? I'm not going to make you. Thank you.
No, thank you. Thank you, ma'am. So the next slide, just want to revisit. You saw this slide before, but I think it's important for you to understand where we've come from with COVID. COVID really decimated the hospital structure at DBHDD. It did that with healthcare in general, but it really had a negative impact on us. So many of those that we compete with for our RNs and our LPNs and our docs raised salaries at such a dramatic rate, we just could not keep up, and we lost 1,238 employees during COVID in our state hospitals. But what I wanted to point out here is you'll see a couple infusions where this committee and this General Assembly and this governor has infused pay packages at our state hospitals. One came in 22 at $24.5 million, and you saw that trend go upward from that point of us starting to gain back employees. And then the additional $10.2 million in this year's budget we're currently in. And again, we were able to see a spike in the number of people coming back to the point that we've been able to gain 51% of the employees we lost during COVID. This is allowing us to open our beds. This is allowing us to treat individuals. It is very challenging for us because we serve a large forensic population. So when our hospital beds are not open, sheriffs start screaming, judges start screaming, and we start having a lot of trials and tribulations. And we've seen that in our hospital system. But I just want to let you know that the dollars you've invested is paying dividends. We obviously are hoping that we'll be able to continue that trend. We did a complete study of our hospital system with Deloitte. They came in and did a deep dive because we know it's more than just money. Money's a big part of what attracts people to come to work for any employer, including the state. But we also looked at recruitment hurdles, and we have a 57% turnover among the millennial population. 29% of all of our employees are going to be eligible for early retirement within 5 years. And then the compensation gap, we're about 24% below market. So we've developed a plan in conjunction with our consultant to catch us up, and the two investments that you made in the department is allowing us to get closer, and we're hoping to be able to continue that. But we're making progress, but we still got a little ways to go. But we're thankful for that plan, that we've laid out a 5-year plan to try to get all of our hospital staff to market rates. This is an area of great concern for us as an organization. We are under state code. The Department of Behavioral Health and Developmental Disability is tasked with taking the forensic population who's been ordered for competency evaluation or has been deemed not competent but restorable and ordered to our hospital. We're the entity responsible for that. We saw a 195, almost 196% increase since April of 2020 in the number of people waiting in a jail to come to the state hospital. This is concerning because this is where you're getting phone calls from sheriffs, you're getting phone calls from judges, I'm getting phone calls from sheriffs, I'm getting phone calls from judges. But I just want to put in perspective so you'll understand, we have a total of 641 state forensic beds statewide in Georgia. Half of those are taken up by individuals who've been ordered to the state hospital not guilty by reason of insanity. Their average stay is 9 years. So on average, those individuals have been in our system a long time, and they're not going anywhere anytime soon. So I only have around 300, 320 beds that I get to turn over for restoration services. Thus, we're having a backlog. That, coupled with the employee loss during COVID, coupled with the fact the courts shut down, the courts then opened back up with a vengeance and hired additional staff, we just have a situation where we do not have enough beds in the state to take care of the growing demand for this service. And it's really putting a strain on our hospitals. It's putting a strain on local governments, local jails, local court systems, because they're frustrated. because on average it's taken 275 days to get a hospital bed. After the order's been sent to us, 275 days on average. And that's unacceptable to us, and I know it's unacceptable to the local courts, but we only have so many beds, so it's a significant challenge. We also continue to have an increase in the number of orders coming to us, and we had grown to almost a wait list of 1,300. But we've taken a lot of steps internally, and I'll go into that a little bit later at another meeting, but just so you'll know, that number's coming down. We're down now to around 900 people waiting on an order. But our staff has really stepped up and is doing a tremendous job bringing that number down. But we can't create beds, and that's a challenge. So you asked, what are we doing? So I wanted to talk to you for a minute about, because this is an area that you're probably getting the most calls about, the most complaints about. We've developed through the Behavioral Health Reform and Innovation Commission a forensic work group. Chief Justice Mike Boggs has been involved in that process. Judge Kathleen Goslin from Hall County has chaired that group. It's made up of judges, Superior Court, State Court, Juvenile Court, Probate Court, defense attorneys, prosecutors, and forensic experts. And they have brought forward a number of recommendations, and that group's continuing to work. And they have proposed some legislation that may be introduced later this year. We've also looked to expand community-based restoration services for individuals who are low-level offenders that have an acuity that would allow them to be served in the community. We also have started jail in-reach pilot programs in 5 communities where we have a full-time jail in-reach coordinator and a full-time forensic peer. That's proving to have good results so far in diverting people out of jail into community programs. We also have stood up 2 pilot programs for jail-based restoration. Even if you gave me the dollars to build a new hospital, it's going to take time to do that, but we've been able to, through a partnership with Cobb County, we've stood up with the sheriff in Cobb 20 beds. It's a separate unit within the Cobb County Jail, and we operate a 20-bed jail-based forensic restoration program there. And then we also have Operation New Hope, which is a facility that we're renovating at our hospital in Savannah. It will be the first transition program within the state hospital. We're excited about that. We coined the term, the hospital came up with this name after Speaker David Ralston's comment after House Bill 1013 passed that today hope won. So our hope is we're going to be able to train individuals, life skills, job skills, technical college training, and get them out of our state hospital, those who've been there for a long time. And then we've expanded forensic evaluators. So just some additional information here. Cobb County, we have 20 beds. We've also got a 14-bed facility in Chatham County that we've stood up. And then we've also been in conversations with Dodge County. There is a DJJ facility there that has 30 beds. It's no longer being utilized, but the state's paying to maintain that. We've had some conversations with the sheriff and the county there and DJJ. Our hope is we may be able to get to a place funding-wise that we could open that up, because that would instantly give us an additional 30 beds that we would move people out of jails into this restoration program. So we're making progress, but we still have more need. I want to just give you a little bit of outcome on the Cobb program so far. 45 program participants, 78% restoration rate, which is a good restoration rate. On average, 86 days average length of stay. In our state hospital, it's about 154 days. And you can see on the next page here, this is a map. These individuals come from all over the state, not just from Cobb County. So 71% are from counties outside Cobb. This is a program the Cobb County Sheriff and his staff's very happy with. We actually just had last week an event in Cobb County where they were showcasing this event, and I was there, the colonel of the jail and other leaders from the Cobb County Sheriff's Office was there. They're very proud of the work they're doing in partnership with DBHDD, and I believe you'll see this happen in other places across the country. One of the other things that we get a lot of complaints on is the sheriffs having to transport people on 1013s and other mental health transports. So one of the things we did down in southwest Georgia is conducted a transport pilot program looking at the number of transports, and they logged 316 transports from August until October, and we were happy with that study. And one of the things that we saw is that the majority of people, the majority of sheriff's deputies were actually pleased with the process when they got the person to one of our crisis centers or emergency receiving facilities. This is a map that shows you the area of the study. So some preliminary findings. This is 316 at a cost of $119. We had one county that was an outlier because they had such a large number of transports just from that one county. As you know, southwest Georgia, for the most part, is extremely rural. So if we removed that county, then the average cost of the transport went up to $141. You also see the average time of being less than 3 hours. It's one of the concerns that obviously we're concerned about as we move forward. We want to be able to decrease that transport time. So some of the lessons that we learned is there were fewer transports observed than we had thought that there might be in that area. There were some counties that didn't participate for whatever reason. We had actually initially invited 30 counties in that area to participate. But we are concerned about the excessive transport times, and we're taking a look internally at GCAL and the bed board and how that process works to see if there's things we can do now to cut down on that transport time, to getting them closer to where they need to be. There's some lessons learned from this data that we're analyzing. We also realize that we need to be able to bring our crisis beds back online. We still have too many crisis beds offline because of workforce. In the big budget that you're going to be taking up later, the governor's proposing fully funding the BH rate study and the IDD rate study. We feel like that's going to have a direct impact on getting beds back online, and that's going to be important to this. One of the things that I've done this year is I've tried to create a lot of partnerships with sheriffs across the state. And I have visited sheriffs in every region of the state, met with sheriffs in their communities, and have enjoyed learning and doing that. And I think we built great relationships through jail-based restoration, through jail inReach, through the study, other programs we're doing with sheriffs across Georgia. So one of the other things that, again, you had asked us to bring forward was any other agency priorities for the amended budget that may be outside of those that's been talked about. So these are some items that just to put on the radar. The Dodge County Jail-Based Restoration Program, I know that's something that Representative Danny Mathis has really worked on. He actually brought that originally to us. So that idea initiated with Representative Mathis because of this facility and his community that is actually within sight distance of their current jail. I know him and Senator Larry Walker have been very engaged. I actually met with them on site at the facility with both the senator and the representative. It's something they're interested in. One of the other things that we are trying to find a way to do is maximize our crisis center utilization. So any opportunity for any type of one-time funding to be able to do some redesign of some temp op beds, do some other things to try to maximize the usage of the crisis centers. People have asked me, if you did that, how would you sustain it? The way is, if we can get more of our crisis center beds open, then we're going to decrease the cost of private psychiatric beds. We're spending $40 million a year on private psychiatric beds. The state is, our agency is, because someone's on the bed board and one of our facilities is not able to take that person, so they transition into a private psychiatric bed at a cost of $40 million a year to the state. If we can decrease that, that's substantial savings that we can reinvest. So we're working hard with our new regional structure we're bringing in place. We're going to really focus on bringing down the private psychiatric bed utilization. Also, something you'll probably hear from your delegation members from the Savannah area is funding for the new Gateway Children and Adolescent Crisis Stabilization Unit there in Savannah. Chatham County has put some dollars forward for that, and I know that's something you'll be hearing about. And then I mentioned already the only treatment mall that we have not been able to construct is over at East Central. So that's there. And then all of our treatment malls are at a cost of $8 million. And then the Sheriff's Transportation Pilot, the idea there is to take the work that we did in Southwest Georgia to the next level. And what that would look like is creating a pilot where we get the sheriffs out of the transport business. Oklahoma has done this. There's a couple other states that have done this where they started out as a pilot and then it worked so well they're now doing it statewide. And this is where our CSBs, our crisis centers, actually go out and do the transport instead of the sheriff. So instead of someone being handcuffed and put into the back of a patrol car and transported to a crisis center, the crisis center comes out and actually does the transport. So our staff's worked closely on creating some pilot ideas around that. So that's another area of interest for us, and I know for the sheriffs, because this is an area that really bothers them to have to be involved in this transport business. So with that, Madam Chair, that completes all of our items for the FY24 amended. I'm happy to answer any questions that you or anyone else has on our budget.
Representative Oliver.
Good afternoon. I'm very happy to see your $59 million for construction, particularly for Georgia Regional Hospital down in South DeKalb, which needs some help. But an issue that I haven't seen on your possibility list that I've heard a lot of discussion about, a lot of support, is the empath units. Could you tell me where that might be in the ongoing discussions, which I think are relevant to helping our folks in the emergency rooms?
Yeah, just a little bit of background on empath units, if any members of the committee is not familiar with it. Empath is a term that's been coined to talk about a facility within an emergency room, off the emergency room. And I liken it a lot to temp op beds. If you're familiar with some of our crisis centers, we have temp op beds where someone can come in and be observed for about a 23-hour period to determine, does this person need a crisis bed? Does this person just need some medication? Does this person just need to be referred to community-based services? And that's what an empath unit does within a hospital setting. So for instance, in South Carolina, I think it was around $45 million they set up as a grant fund, and each empath unit cost just under $3 million. So hospitals would apply to the state for an empath unit, and if they were funded, then it's sustained through the billing of Medicaid and private insurance. So it's one-time funding that goes to a hospital. I always remind people that an empath unit does not replace a crisis center. So we've done a crisis center study, which you'll hear more about in the big budget. It's not going to replace that, but what it does do is relieve the person who's in the emergency room who may not need a full crisis stay, but they can move into this empath unit. Couple of things, if you were considering that, I would suggest is, number one, the decision on where that should be based on where you're going to get the highest return on investment. So you can look at where are people getting stuck in the emergency room, where are people having to wait the longest time for a bed. And then I think it also has to be in partnership with a willing hospital. So this is not something you can force on a hospital. It has to be something that they're willing to take on. But other states have done this, including our neighbor South Carolina. And I've had several conversations with our partners in South Carolina and other states about these units.
Chairman Mathiat, are you trying to make
Right.
Oh,
Okay, there we go. Thank you, Commissioner. I so appreciate the information. This may be a big budget question, but I'm going to ask it anyways. Since we're talking about age of buildings, what's the age of the software that is connected to DBHDD?
Well, in our hospital setting, our software system that we operate is fairly robust and is not aged. One of the challenges we face is we operate through providers. On the behavioral health side, our crisis centers, our CSBs, they don't necessarily all operate on the same platform, so that's challenging because, if someone comes into a crisis center here in Atlanta, say DeKalb, but they were in a crisis center somewhere else in the state 3 months ago, they may not have access to those records, so that's a challenge. Within our hospital system, though, and Brandon Kinney is here, and I'm going to introduce before I end my staff that's here, but Brandon is our Assistant Commissioner of Operations. He was a CIO in the corporate world, and he's working closely with Jason McSwain. We're doing a lot of upgrades around our electronic record systems, et cetera, within our hospital setting. But our biggest issue with technology really is in our provider base is having them communicate with each other.
Gotcha. Thank you so much.
Thank you.
Hello, Commissioner. I just wanted to thank you for highlighting the work that is happening in Cobb County with our sheriff. It is a real point of pride to know that we are able to be a part of this because the results are quantifiable, they are tangible, and I just wanted to share that we are in Cobb County. We are very grateful for this partnership.
Well, thank you. And it gives us instant beds, and it gives us instant relief, and I appreciate the Sheriff of Cobb County's willingness he's not just taking Cobb inmates, he's taking patients and inmates from other facilities, and that's helping Floyd County and other counties all across the state, so thank you.
Let's try that. Representative Cameron?
Good afternoon, Commissioner. Do you have staff that specifically reach out to sheriffs, or a unit that reaches out to sheriffs where they can provide input to your department about their specific issues and needs?
Yeah, we do. We not only do we have our community outreach team, they participate in the sheriff's conferences. I personally have probably visited with 75 sheriffs in the last year. And then I also go to, in their communities or in their regions. And then we were just at the sheriff's conference here up at Chateau Alon just a couple of weeks ago, and we had multiple members of our staff there. But yes, we have conversations with them on a regular basis.
Thank you. Mr. Commissioner, let me ask a question. You said the average stay is 9 years for a bed, correct?
That's for an individual who's been ordered there for not guilty by reason of insanity. On the forensic side, the average stay of the people we have there currently is 9 years. That's correct.
Okay, and with that, what happens after 9 years?
Well, we have some individuals who've been there 25 years. But individuals, once we believe they're clinically ready to be released from a clinical perspective, we notify the court, and the court has routine hearings to make a determination. They make a determination whether or not to release the person, because the person that's there for that length of stay and for that purpose had committed a crime, and they were found not guilty because of their mental status. But it's up to a judge to make the determination. Now, when they get to a point where a judge feels like the person stayed there long enough, I have had enough clinical evidence to believe the person is ready to get out, then typically the process is for them to go to a community integration home. And that is a home of several individuals that have supervision, but they are able to go out to work during the day. They're able to go to school. And then they come back at night and they have classes and therapy sessions, et cetera. And then the next step would be to go to a forensic apartment, which is less supervision. And then ultimately the court allow them to be under no supervision.
Thank you, and I've experienced that, and it works very well. Another question, just curious, in Cobb County, Chatham County, and Dodge, How many employees? You have 20 beds in Cobb. How many employees does it take to run that facility?
We don't have any employees specifically there. What we do is contract with the Cobb County Sheriff, and he provides, his jailers provide the security. They typically, in the control tower there, they have one officer, and then any time that our clinicians are inside the pods, they have another officer, so it's two officers. And then we contract with WellPath, which is the same health provider for their physical health at the Cobb County Jail. We're contracting with them to provide the clinical work. Now, our community forensic evaluators, our psychologists, when they believe, when their clinicians report to us that they believe the person is competent, then we will send one of our DBHTD employees out to do the evaluation. But it's a contract with Cobb County.
Thank you.
Thank you.
Commissioner, I know, kind of staying on the subject of the forensic beds, I believe a recent study showed that we need about 119 additional
Forensic
as a minimum.
beds.
Is that right? And I know we're getting requests across the state from many people with some very creative and genuine plans to do that. One of the challenges, as I understand it too, is that that population is not served in a crisis center, right? So kind of what happens, like whereas a different kind of patient would go into a crisis center. So how does that process start?
Yeah, and I appreciate the question. The bed study that was done by A&M, they did a tremendous job. They looked at our crisis network across the state, and they identified we had a gap of needing 8 additional crisis centers over the next 10 years in Georgia. 5 of those being in the metro area, just because of population. And it also looked at our inpatient beds, because a crisis center, as you know, Chair Lady Dempsey, is a place for someone to go for typically 3 to 7, maybe 10 days. But it's not a long-term stay. So if a person needs an adult mental health bed, inpatient bed for a long period of time, then that person has to come to one of our 5 state hospitals. We have just over 1,000 beds total in our system. 641 of those are forensic beds. And I mentioned earlier, half of those are taken up by people who've been found not guilty by reason of insanity. So what the study also identified was we need 119 more forensic beds. I'm glad the study said that, because I can tell you, based on the phone calls I get and the complaints I get, I know that we need more beds here in the state of Georgia. The other things we're doing, like Cobb County, Chatham County, Dodge, those are stopgap measures to be able to help us until hopefully we can get to a point that we can actually have a facility that's able to handle Georgia's a growing state. I also believe that judges and prosecutors, parents, spouses, everyone's becoming more aware of people's mental health, and stigma is being decreased, so people are raising that as an issue in their court proceedings. So I think you're going to continue to see the number of people being ordered to our state hospitals is going to grow, and we have to be prepared for it.
And on the other end of that spectrum as well, when you talk about restoration and the steps that you go through to get there, what about housing vouchers? How are we doing in that right now?
Yeah, as you know, Chair Lady Dempsey, the Georgia Housing Voucher Program was established as part of the Department of Justice settlement agreement with the state. And Maxwell, that runs that program for us, has come in and does a tremendous job. But we're required under the settlement agreement to do evaluations and applications from people in jail, hospitals, prisons, etc. And if that person has a diagnosed mental illness, and they do not have the ability to have housing, we're mandated to provide a housing voucher through the Georgia Housing Voucher Program. That program continues to grow to the point that it's very difficult for us to keep up with existing funding. We've added some additional dollars to that. We try to scrape and find money internally, but that program's going to have more dollars. And that is, I will tell you, and Monica's here, she's our Chief Legal Officer, that is something that we're under the microscope on with the Department of Justice. But I will also tell you, they've been extremely pleased with how that program's been going, and I was hoping that I'd be able to make some announcements here, but we're hoping before you leave session this year, we'll be able to have some positive news around the settlement agreement. But we are making progress, but it's costly.
Mm-hmm. Wow, and I appreciate your continued work on that, no doubt. In some of your presentation, I know you said something that kind of struck me, because you said, if you gave me the money to build a new hospital. You mentioned that. And I know in our districts, particularly where I live in Northwest Georgia, where the hospital was closed, I hear all the time, why can't we just build a new hospital? And everyone in this room may understand that, but I'm not sure that everybody that's out in the state understands really why we're going through these very creative ways to deal with the problem, because we cannot just build a new hospital. I wanted to give you an opportunity maybe to help with that.
Well, that's when it comes to the adult mental health population, through the settlement agreement, we're supposed to serve those individuals. The desire is to serve those individuals in community settings, which the state's done a good job over the last 12 years of standing up that community program. But where we need more beds is in the forensic population, and that's where we can build facilities to take care of that population, because those are individuals who have been ordered there by the courts. So this is not someone that is there just because they have a mental illness. This is someone who is there because they have entered the criminal justice system and the courts have determined that they're not competent and they've been ordered to the hospital. That's where the backlog of almost 600 individuals is coming in. That's where we've got to find a way to increase our capacity. But as far as the adult mental health population, those individuals, by the settlement agreement, need to be served in the community.
Mm-hmm. Just a couple other quick things too. So wondered if you could give us a little update on the current status of the opioid settlement.
Absolutely. So as you know, the position I'm in serves as the trustee of the opioid funds. One of the things that we have done is taking a very methodical, slow process and making sure that when all the opioid dollars are expended, we want to make sure the state of Georgia is held up as an example of how it should be done. So one of the first things that the department's done is brought in a group to do an inventory of the state, a current inventory of all services available in Georgia, all treatment facilities, et cetera. That work has been done. The second thing that's been done is to create a vision of what the perfect continuum of care looks like across Georgia, and what is a visioning document, and then also creating some guardrails around these in order to get us where we need to be as a state. These are the guardrails that need to be in place for funding decisions as we go forward. And then currently, Brandon and our IT staff are working with a group called RMS to build out a portal that will become the forward-facing portal for grants, and that will also be the funding arm, the arm that will handle the process from beginning to end. We anticipate that my target is, well, and let me say one other thing. The other piece of the settlement agreement is local communities have to come together within regions to elect a regional advisory council. And we as a state are not able to direct that process. So, but thank goodness ACCG and GMA have stepped up and they're coordinating that. It is our hope that those will be in place by the end of March. And my plan is before you leave session this year, is to be able to roll out some announcements jointly with this General Assembly and the governor on the first grant opportunities being opened up. So the portal has to be in place, the public-facing website has to be in place, the regional advisory councils have to be in place. The governor has appointed the members to the statewide advisory group, which is called GOSAC. Now the local governments have to appoint their members. ACCG and GMA are also working on that. So everything's underway to an end of March go live date to get this rolling. So we're excited. A lot of progress and a lot of work has gone in. I want to give a lot of credit to Cassandra Price and Brenda Woodward and Monica Patel and all the other folks internally that really they've been working on this for the last year, and they're making it happen.
Great. And one more thing, hopefully an opportunity for you to brag a little bit here. 988 was originally meant to have a soft launch, and now I know we're getting ready to be at a place where we are maybe perhaps about to ramp it up. So maybe you could give us a little update on that as well.
Yeah, it's it's nice when you get to be the commissioner of DBHDD and all the other states are looking at Georgia really as a leader in 988. And when they decided to come looking at what state they were going to come to celebrate the year anniversary, they came to Georgia. So Georgia has done a tremendous job, and it has a lot to do with the foundation that was laid for many years with our GCAL and 1-800 number. But you're right, there's been a concern nationally about ramping up too quickly with marketing. That's starting to shift. One of the things that we've just rolled out in the last few days, which is this is not a really good, I guess, correct word, but it's a cool campaign, is hashtag 86 the stigma. And it's in partnership, you may not know this, but the second highest suicide rate among a working class is restaurant workers. So we've partnered with the Restaurant Worker Association and others, and they're doing 86 the stigma campaign. So you're gonna, if you go in, Rays on the River, for instance, is one they're wearing t-shirts, hats, and the pens they're riding with all talk about it's okay not to be okay, 86 the stigma, call 988. So they're promoting that. So we have restaurants all across the state now that's going to be a partner in that campaign. The First Lady also filmed several commercials that's now appearing on TV statewide. You'll see billboard campaigns and other things starting out about promoting 988. So we're extremely excited about that, and we're getting a lot of good results from that. And we have, and I will tell you, I'm presenting to the National Association of State Mental Health Directors, I think it's later this week, about 86 the Stigma campaign. So they want us to promote that nationally. And that's also going to roll out nationally after it comes out here in Georgia. But that was all came from one of our staff members actually having a conversation with a restaurant person and came up with the idea. So we have some very talented individuals at DBHDD. So stay on the lookout. We've got some great marketing things coming out about 988.
Well, thank you for the profound effort I think that will have to save lives,
Yes,
without
ma'am.
a doubt. Are there any more questions from the committee? And I know some of the lights are not working, so don't hesitate to raise your hand if your light's not working.
Madam Chair, would you mind if I introduce my staff? that's here?
Please, please do,
I just
yeah.
want, Chris Hamilton's our CFO. He does a tremendous job. Brandon Kinney's our Assistant Commissioner of Operations. Monica Patel's Assistant Commissioner of Agency Affairs. She took Ashley Fielding's place. Ashley went to Piedmont, but Monica's been with the agency for 10 years. She's an attorney. Unfortunately, a Michigan fan, but we overlooked that. And then in the back, I've got Michael, who has our legislative affairs. He was born and raised here in the House, as you know. And then Kennedy, we got her from the Senate, but her mother was born and raised in the House, Kathy Little. And then Patrick, he's on our legislative team, so they do a tremendous job, and we're thankful for what they do for us. And they're open to helping you anytime you need it, so just let us know.
Thank you so much. That is a great team that you've amassed,
Yes,
and
ma'am.
I know there are others that
Yes,
have had some House experience as well that are going to be there with you and just helping the challenging work that you
And
do.
Madam Chair, I will announce publicly that Camille, who came from the House, had her first baby over the weekend. It was a very healthy 8-pound, 2-ounce baby boy. Mother and baby and father are all doing well. so-
Oh, that's excellent. Thank you.
Yeah.
Thank you for that good news.
Thank you.
Appreciate it.
Thank you.
Thank you. Okay, yeah. Okay, so next, Commissioner Brose from the Department of Human Services will be ready for you to present. Where'd you go? Good afternoon. I want to thank you too for the really robust presentation that you gave us last week during the full joint budget hearings, but we'll look for a little more today and see what we can dig into and help. Thank you.
All right, well, good afternoon, everyone, Madam Chair, and members of this subcommittee. I'm Candace Brose, and I'm the Commissioner of the Georgia Department of Human Services. Some of this will be from the last time I stood before the legislature, but again, our department has three main divisions: Aging Services, Child Support Services, and Family and Children Services, or DFACS. We have a little over 9,300 employees, and we have 233 office locations. So we just have a few slides to cover the governor's recommendations for AFY 24. So you can see there that $18 million figure. That is the recommended funding for the agency, including our attached agencies. And under statewide adjustments, there's an increase of $10,334,410, and that is for the $1,000 bonus that the governor announced toward the end of last year. And again, quickly, for AFY 24 workload adjustments, there's $8,129,590. So I'll get into more specifics further along in AFY. Okay, so for your tracking sheet, I am going to the Child Welfare Services budget. That's page 5, I believe. Last time I was here, I was using the wrong document. So hopefully this is the right one. Page 5 with the House budgets track sheet. The first item is line item 28.4.2. That's a little over $3 million for technology upgrades and improvements to Shines. That's our case management system that DFACS uses on the child welfare side for foster care, family support services, family preservation services. And this particular line item will help us upgrade that system. We're constantly making upgrades to the system, either just to patch security issues, to make sure that we change things to comply with federal or state law, or because we've changed a DFACS policy. This particular system is almost 2 decades old, so we will need to replace it soon. But right now what we're doing is we're constantly making those upgrades, and this will help us move it to more of a modular-based system. That will also help us too when we actually pull the trigger and move to a full replacement, to phase into units, if you will, of replacement technology. This request also specifically provides for ongoing operation of what we're calling our data lake project. We rolled this out a couple of years ago, and it was right after I joined the agency. When someone reports abuse or neglect to DFACS, a caseworker is documenting that interaction. And so literally, if they're on the phone, that means that they're getting their name, contact information, the allegations under that, or related to that abuse or neglect, information about the people, the maltreaters against whom those allegations are made, and the children affected. And so before this data lake project was rolled out, what that meant is they were simultaneously documenting that interaction, and they were also logging into multiple systems with different login credentials each time to cross-reference records for involved parties. So they were looking at correctional data, sex offender registry information, if the family has any household benefits, all at one time while documenting the interaction. So people called it the swivel chair back and forth. That very much was like that. But this data lake project meant that we pulled all of those databases into one place. There's one login, and that means that they are looking at it really all at one time. So when we did a time study, we saw that it shaved off about 30 to 45 minutes per interaction with someone calling in a complaint, which is a huge time savings and means they get to focus more on talking to that person and understanding what happened if we then decide that we need to move forward with an investigation. So for the next recommended change, line item 28.4.3, it's a little over $200,000 to cover the full cost of 2 community action team pilot programs. So this was originally funded in 2022. What these groups are, these groups include basically an administrative and clinical team that goes to work with a family when a referral is made to provide in-home services. Right now we have 2 companies that we've contracted with in 3 total regions, but it's an overall 33 county initiative. And what it means is that they're assessing the family in the home. They're trying to help them with treatment. These kids have complex needs, so they may have prior involvement with the Department of Juvenile Justice. They have some complex medical or behavioral needs, and the pilot is truly intended to provide in-home support with a team that goes to them instead of the family expecting to find the team. And it took some time for us to get the contracting process underway so we could get the best deal for the funding that we got. But right now, those 2 vendors have a total of about, let's say, a dozen cases each, and that'll just continue to expand as they get more referrals. Okay. For the next program budget with workload changes, it's still on page 5 of your track sheet, line item 28.6.2. That is just shy of $2 million to integrate Georgia Pathways and Georgia Access, which are the governors to healthcare waivers. It's Section 1115 and Section 1332 waivers, both for Medicaid and private health insurance. This money will allow us to integrate the technology for administering those waivers with Gateway, and basically for those programs to be able to better leverage the eligibility algorithms that we already have built into Georgia Gateway and talk to each other more effectively. In the second recommended change, line item 28.6.3, there is a little over $2.6 million in a reduction to reflect savings from office space consolidation. We had 17 floors in 2 Peachtree. We now have 2 floors with flex space in the 47 Trinity building, and we were able to make that move by also leveraging just the huge statewide presence that we have. We have at least 1 county office in every county, and sometimes more than 1. So we're letting people use that as much as they'd like and have that smaller space in Atlanta. On line item 28.6.4, there is a little over $1.5 million added so that we can cover higher than expected costs for mail. That's a pretty common occurrence in our agency, given how often we're interacting with just the sheer number of Georgians across the state for benefit programs. And in this case, it was because of ongoing Medicaid redetermination. We're having a lot of interactions with recipients of public assistance, and so this will adjust for those higher volumes. So that total add, that $1.5 million, is actually comprised of $910,530 in new funding and a redirect of $590,000 from the Elder Abuse Investigations and Prevention Program budget from a disregard. Going to Elder Abuse Investigations and Prevention, just to again state, it's line item 28.7.2. There's that actual transfer, the $590,000. For federal eligibility benefit services, going on page 6 of your tracking sheet, line item 28.10.2, there is a reduction of $65,524. When we started the Medicaid redetermination process last year, we do have some notice functionality in Gateway, and now, in fact, all of that is built into Gateway. But at the time, we wanted to have a sort of backup system for notice generation because that is such a key component of the Medicaid redetermination process in terms of our legal compliance. So we had this contract as a backup mechanism, but we're pretty far along in the process, so it is duplicative at this point since we've built all that functionality into Georgia Gateway. On the next recommended change, line item 28.10.3, you'll see a little over $2 million in added funding, which is just to cover a contract increase from Equifax Talix. Talix is the product that we use, but it's for income verification for Public Assistance Administration. Still on page 6 for line item 28.14.2, under residential childcare licensing, there's a $360,000 increase to improve the Trails system. Trails is what we call the system for that residential childcare licensing unit to credential child placing agencies, which are those entities that help either with adoptions or to help recruit foster families for DFACs, for child caring institutions, which is commonly just referred to as a group home or congregate care provider, and similar residential facilities for children and young adults. So with this funding, we'll improve that technology. For example, right now that system has limited document upload and storage capacity, so we'll expand that. And there's also a limit to overall users, so that will be expanded with this new funding. One last thing as an example, it doesn't have an autosave feature, so if you spend a lot of time as a provider putting this in the system and you don't save it, then it all disappears if for some reason you lose the connection. In the next recommended change at line item 28.14.3, there's just over $82,000 to establish an application and inspection process for qualified residential treatment programs. So a few years ago, there were changes to federal law, and there were some limits in the amount of federal funding that states can draw down for how they pay for foster care stays at certain congregate care settings. One of the exceptions, if you will, to that limit in federal funding was if states implemented the QRTP model. And that model has some additional requirements just to make sure that if a foster child is in a congregate care setting, that it has more clinical supports and wraparound supports on site. And so what this will do is to allow our agency to roll out this new license type. Of course, we desperately need this additional capacity for children, both at risk of entering foster care and in our custody, that have mental and behavioral health needs. And it really, it specifically addresses this category of essentially non-existent providers that we have, where a child would go from an inpatient setting straight to a community-based placement when you need something in between. This will meet that need, and we're really excited about kicking off that credentialing process, but also working toward a pilot with a provider in the coming months to officially have these facilities in the state of Georgia. In our last two program budgets, there's no changes for the amended, and the remaining programs reflect administratively attached agencies, but I always cover the Safe Harbor Commission, for which I currently serve as chair. So there's a little over $2.7 million to increase funds to cover the cost of the Gwinnett Commercial Sexual Exploitation Recovery Center, named Grace's Place. That, I talked about this at the last hearing, but that brand new 24-bed facility will offer housing and transitional living, mental health counseling, substance abuse treatment, education. It's a Gwinnett County School System approved location, and medical services for adolescent survivors of sexual exploitation and trafficking. And this has been an initiative of the First Lady. It's been a close partnership with several other agencies to make it happen: DJJ, GBA, DBHGD, GBA, Georgia DOE, Gwinnett School Systems, and of course our providers, with Devereaux being the provider that got this contract to serve vulnerable children. So my understanding is that it will officially be able to start accepting referrals in the coming days, which is wonderful because we certainly have children that meet their criteria and would be best served at a facility with these supports on site. Lastly, before moving on to your questions, I just wanted to give you an update on recruitment and retention of child welfare case managers and eligibility program caseworkers. In fiscal year 2024, you appropriated over $11 million in state funds, which meant approximately $33 million when matched by federal funds for us to hire, at the time, 525 eligibility caseworkers and supervisors to process Medicaid redeterminations. You can see the headcount and the progress that we've been able to make with that additional funding, so thank you for that. It means we're serving families, and more families, more timely, although we still have work to do, but this has been a huge effort in the agency. And I think since I blew over slide 5, I feel back up one so I can show. Okay. You can also see the progress that we've made for child welfare. In other words, child protective services and foster care, family support and family preservation, caseworkers. That jump, just again, aggressive recruitment and retention efforts. The pay raises have made a huge difference. Career ladders, lots of strategic initiatives to try to keep top-notch staff and recruit quality staff. So with that, I've done with my remarks, and I will take any questions.
Do we have any questions from our members? Okay, let me see. Number. Oh, sorry. Let's try that one. Okay. Representative Sainz.
Thank you, Madam Chair. And Commissioner, thank you. I know that the service delivery structure for DHS has changed dramatically through COVID, and I've never personally witnessed a more agile and responsive part, especially from the Atlanta office. I wanted to ask about the line item 28.7.2, the elder abuse investigations and prevention. I know from an anecdotal perspective from constituents who call, many aren't aware of the department's role in investigating elderly abuse, and we also know through the pandemic transition, there's less instances where caregivers and individuals who come into contact with our senior citizen population in certain parts make that contact. And I'm assuming, like parallel to when students weren't in school, there was a drop in those investigations. Is this reflective of a reduced case amount, and do you see that reduction being lower? Could you expand on that general reduction?
Right. This particular line item was funding that had been added into the budget for the state's long-term care ombudsman within our agency. And so it is not a reduction in terms of positions or services, but it is related to that ombudsman, their work across the state.
Good afternoon, Commissioner. Thank you. Based on last week's meeting, you sent out a defects lobbies map. I was just looking, some maps or some counties are open like 5 days a week, but one of my counties, Dade, is only open 2 days a week. Is that a utilization or is that a staffing issue?
It's staffing.
Okay.
It's staffing. And so that's where we've, fortunately, the governor's recommended some additional funding for us to be able to hire those roles so that we can literally have people who are working the office lobby. So with the legislature's support, we'd be able to bring all of our counties back up to 5 days a week, normal business hours.
All right, thank you.
Representative Oliver.
Good afternoon. Could we go back, please, to your slide about the increase of staffing for child protection workers from 1998 to 2111? I remember, and I'm probably wrong about this, so correct me, that the number of positions you had for child welfare caseworkers was above 2,500. So I'm still trying to figure out what your gap is. I'm still trying to figure out how many empty seats are out there in this category of workers.
I think it boils down to funded versus unfunded vacancies. So on our books, we have probably a few hundred positions.
2,600, 2,700, maybe?
I think it's a few hundred, but it's their unfunded vacancies. And so right now, based on what we have budgeted, I don't think we've really got any empty seats. We're actually above our budgeted funding for positions.
What's an unfunded vacancy? I mean, if you have...
It's just a relic of, over the years, DFACS using a different personnel management system. So if the funding was decreased at any point since then that meant it translated into a reduction in positions, and it's something that precedes my time at the agency, but one that we're trying to rectify whenever the state moves over to a new personnel management system.
Did you just tell me, and I'm sure I'm just confused here, but did you just tell me that you have 200 to 400 fewer caseworkers today than you did 5 years ago?
5 years ago?
Or 6 years ago? Or have you dropped that many caseworkers?
I think it's been over many years, much longer than that, that if the agency had reductions in a program budget, that it meant that it translated to unfunded vacancies.
I'll try to follow up on that if I may ask one other question, Madam Chair. I'm hearing that your CAPTA committees, independent committees, have been, I'm not sure what the word is, eliminated or reorganized. And under the federal statute, I thought those were mandated. What is the impact or what is the policy decision to eliminate those independent child prevention committee groups?
They're not being eliminated. They're being reorganized and restructured. When we looked at some other states' models, what we saw is that there was there were more regional approaches. That it meant that there was a change in composition over the years. And for us, we're trying to reorganize so that we have a more diverse composition of those panels across the state.
Perhaps you could give me some follow-up of what exactly that means in terms of practicality and independence of those groups.
Sure.
Thank you.
Excuse me, are there any other questions from committee members? I'm not seeing any lights, but I'm making sure. Well, let me ask you a little something here. So, data links, shines, upgrades, kind of is, that language is pervasive through this budget and has been for years. And there are huge needs. And I know we have some other places in our state budget that we're looking at doing some big, massive projects. And those are big, heavy lifts, there's no doubt. But I just wanted to see how much you might think we're not able to do, because right now we don't, your agency particularly at many levels does not have what could really expedite careful care, watchful oversight, immediate transition of facts that are so important, whether it's with the elder population or our youngest little people that are being picked up by DFACs.
Right.
Just wondered what a long-term, I know we have to look out there on this. It's not something we have a magic wand over, because I would if I could, but what can we do to help here?
I would say, if practically speaking, it would be incredibly helpful if we had more of a golden record. State agencies interact with so many of the same people and children that we do, and although we're always trying to make improvements to our technology to pull that information on demand and stay updated in our systems, we still have, even in Shines, we may have the same person in there 10 times, just with slightly spelled differences in their name, or year off, or birthday, or a different address, a different household composition. So if you think about what that means for on-the-ground work, it makes it quite difficult. And again, state agencies already have so much information across the board, but it would be very helpful if on demand there was a cleaner record that reflected what every agency already has about a family, so that when we're interacting with them, and I know that my colleagues in other agencies would agree, we know if they've ever had interactions with a CSV, right, immediately, for things that maybe did work or didn't work, so that we're not paying for something that didn't work, or we know how to just integrate a better case plan for the family. Their education records, immunization records, people that need help with transportation, since that's something that we can certainly assist with, but those kinds of things across the board, a more comprehensive, accurate view would be wonderful for us to better spend the money that we get to help families, and for staff to be really boots on the ground much faster and more efficiently when they're trying to help.
Well, I want to ask you to continue to explore that in ways that we can, and some ways we can navigate that, and then we can help you do that, because I know there are some systems that perhaps communicate with each other a little better. Mm-hmm. And I have been there, it's been a few years, but I did watch several calls as they were picked up, and how hard it was for that person to bounce back and forth between systems. And during that moment in time, a child's life could very much be in danger.
That's right.
So I want to encourage you to continue to explore and let us help with that. As well, I just wanted to talk to you a little bit, too, about morale. I know there's been some tough messages out there this recent fall, and how your central staff, everybody that's here to support you too, how's everybody doing?
I would say I think that there's no question throughout the agency that we are supported through the good and the bad from the state. And you can see it in our human resources numbers. Turnover is slowing down. There are some categories recently where I think because of retirement, we're starting to see supervisors and those leave, but it's been clear from the investments that the General Assembly and the Governor's Office has made into our agency in recent years that they're supported, and that helped people stay strong when the criticism got really, really bad and frankly unfair. But we're not afraid of accountability. We're okay being under the microscope. That's the nature of our work. And so when we have shortcomings, we're trying to do our best to address them and be honest. But we are, DFACS, the agency as a whole, we're saving more kids and more adults and countless lives, and always have been. And so we're really thankful, not just the financial investments, but the phone calls and the messages. I always get these beautiful emails forwarded up to me from like a foster parent that reaches out to their former case manager who now maybe is in DFACS leadership and says, I saw that, this piece or that piece, or I saw what so-and-so said, and I just want you to know that I know what's really going on and I have your back. And that goes a really long way.
Excellent. Excellent. Well, I know that each of us in our districts hear from a lot of people. This is one place where you hear mostly when it's not working right, much more so than when it is. So I want to thank you for your commitment and persevere.
Thank you. Thank you for your support. All right. Okay.
Next, we will hear from Commissioner Patricia Ross with the Department of Veterans Services.
Good afternoon, Madam Chair, members of the subcommittee. It is definitely my honor to be in front of you today. I'm going to do things a little bit different since I've already spoken to you as part of the joint appropriations hearing. But I did want to say, this is our mission and our vision for our department, and those are our 4 programs, so that's kind of where I'll touch today. But first, let me talk about what we have done just in the last year alone. First and foremost, I think our agency was one where we expected veterans and their families to come to us. Instead, we've flipped that, especially over the last year with the PACT Act, which was major VA legislation that entitled many more of our veterans to be able to receive benefits based on those things that were considered presumptive, toxic exposure. So we've been going out into the community. I know I showed you these numbers the other day, but we did have over 40,000 claims submitted this year alone. I also shared that entailed about $4.4 billion into Georgia's pockets. But here's where I'd like to just sit for a minute. We're going out to your communities, to veterans communities across the state. Over 1,200 veterans began a benefits claim at one of these outreach events, and you can see where they're all over from North to South Georgia. In addition, with our partners here in the room, as well as other community partners and social support organizations, we actually referred almost 8,000 veterans to other organizations to get those wraparound services that may not be VA benefits related. And I know we talked with DBHDD. I saw Commissioner Tanner speak earlier, but we are definitely working with them to help with our suicide prevention efforts. So we had over 5,000 veterans screened for suicide. And I'll talk a little bit more about that. So this is just one of those feel-good pictures of us out and about, but I am so proud of the team within Georgia Department of Veterans Service actually kind of flipping the model and going to where our veterans are versus expecting them to always come to us. So talking about DBHDD, this is a campaign we did just November to December, or December to January, hitting the holiday season. So we did a Facebook social media campaign. This was funded through a federal grant by the VA, but we targeted different groups of veterans. And so that's peer-to-peer. The ones you see here are older veterans as well as our women veterans, because we do have the fastest growing population of women veterans in the nation. We reached over 2 million. And these were just little ads that hit folks in key areas that I'll talk about, but directed them to 988 in the crisis line, where if you're in crisis, please reach out to our partners in DBHDD to make sure you're taken care of. And we did this very targeted outreach, but it was very successful for something that ran for just a short amount of time. So with that, going into the 24 budget, we are actually on page 9. Not a lot to talk about necessarily with the amended 24 budget. You can see we did get the increase for salaries in 4811, which was just over $16,000 in our administrative program. You saw, I know I talked about it the other day, the $1 million that transferred from our cemetery program up to administrative program. That originally under House Bill 414 last year was meant for DBHDD, but it is a veteran mental health grant. So now we actually grant that. That was $750,000 last year, and we're hoping with your support that that stays to $1 million that again was moved from the cemetery program. And then we did have a reduction of 1 vacancy. Something Commissioner Brose said earlier, kind of one of those unfunded positions. Prior to my time, what had occurred is my predecessor had taken some of this funding and we were not able to fill a position. But because of needs within this administrative program, which is a very small program for our department, that funding was used in other ways, and we were never able to hire for this position. So I would appreciate not having this position taken because the funding is being used in other ways for administrative support within our department. Looking at our memorial cemeteries, again, the $1 million that was there to help with our grant for the new Augusta Veteran Cemetery. We had a grant to the VA over the last several years. That was the 10% matching. We were not successful with our grant application this past year. And so that is what was shifted to the admin line to be able to fund that mental and behavioral health grant. And so you can see we net out just less than about $1 million, which is what, of course, was taken from that program and reallocated. For our War Veterans Nursing Home, that was one position that got that $1,000 salary increase. The rest of our leadership team actually falls under our administrative program. We did transition, I know I talked about this the other day, to a new contractor in our Milledgeville home. So this is a portion of those transition costs that they incurred in taking over from a long-term contractor when they had to literally within 2 weeks get everybody boots on the ground to transition employees, records, equipment, etc. And so that was a Herculean lift on behalf of our state home and the leadership team. And then in our Veterans Benefits Program, where the majority of the personnel reside within my department, the increase there, again, was the salaries. Now, we have seen, and thank you for your support, and an increase in salaries. We've seen a reduction in our attrition rate, so this is definitely helping us to continue to attract and retain individuals for our department. I was asked to speak briefly about some of our requirements that we had put forward but were not in the governor's recommended budget. So I will just touch on those very quickly. You do have all the details in front of you with your slides. So for our state veterans homes, over the last decade, the VA increases their rate every year. And in fact, in 2023, they increased it twice to the tune of 7%. The way our funding model works for our state veterans homes is with state appropriations plus any patient fees, which we went to back in 2011, 2012, that has to be 1 cent more than what the federal government or the VA pays. What has happened is without an increase in state appropriations, but we've continued to increase patient fees, we've not been able to keep the number of patients we would like to in our 2 homes. So that we had asked for a 10% to just kind of catch us up the last couple of years, so we could not only retain our patient census, maybe grow a little bit, as well as help us open that subacute therapy unit. So that was in the budget, but not in the governor's recommended budget. Also, as a one-time cost, I, like many of our staff, are post 9/11 veterans who were exposed to toxins in the Gulf or in the Middle East. A lot of us have respiratory issues. Our furniture, paint, cubicles, et cetera, haven't been changed out since the 80s when folks were smoking in the facility. And so we had asked for a one-time cost. I will tell you, we were trying to get newer figures. We have been blessed to have great partners down the hall from us who have given us some of their new cubicle furniture. And so we are taking what we can get to be able to upgrade our space to make this a healthy environment for our employees. So that's central office. Feel free to come visit us in the East Tower. And this is what I was talking about a little bit earlier. So I know this map is probably hard to see, but we have had targeted outreach based on social determinants of health for our veterans around the state. And that has been through partner organizations, but also trying to make sure we're getting those resources and we're asking those veterans what they need. And you can see kind of our top 2 areas other than the family support is or mental and behavioral health, as well as housing or homelessness. And so we had asked for some one-time funding for our foundation. We kind of restood up our foundation last year. We do know other states around us get appropriated funding for their foundations, and that is to meet our foundation's priorities, mainly of mental behavioral health, as well as housing or to help with homelessness. If you've read any articles about veteran homelessness, that is the #1 predictor of whether they are at risk for suicide, if they've been homeless at any point in their life. So we're definitely trying to get ahead of that crisis to be able to save as many lives as we can. So that was based on the data we had gotten through our Unitas model. And tied to that was a homeless coordinator. We've done so much with our suicide prevention and outreach coordinator. Y'all were so kind to give us in the FY23 budget. But we are tackling homeless with 2 individuals that are kind of working it on the margins. Our women and minority veteran coordinator, as well as our suicide prevention and outreach coordinator. And quite honestly, it's just not enough. It's a full-time job for somebody to coordinate care across all of the different community-based partners, as well as the U.S. Department of Veterans Affairs, so we had asked for that as well. That just covers, again, what was not in the governor's recommended budget. As far as our capital outlays, there were a couple of items. We did get a portion of the funding. We have aging elevators. If you've been to our homes in Milledgeville and in Augusta, they are multi-storied buildings, not like what you would see in a new skilled nursing home. The elevators are getting close to their end of life, and so we had asked for funding to redo the elevators. We got a portion of that. And our second priority was fire doors there in our Milledgeville campus. That was mainly because they've been drilled through and no longer are considered fire doors, so we keep getting written up for that by the VA as well as our other agencies that inspect us. And so those are our 2 top priorities, as well as capital outlay. I know I got a couple of questions on this. The study we had done through Kennesaw State, as well as a Senate subcommittee, which identified kind of 2 short-term areas to put new veterans homes. Again, it's a different model. It's that small home type environment where you have about 100 beds with a common community center. We did find location down in Waycross through state properties, and we had put in the budget, that's kind of what it would look like. We would be co-located or next to Coastal Pines Technical College, which would create some great synergies with them and their programs. But that, of course, was a 35% match in construction cost with the U.S. Department of Veterans Affairs to be able to submit in April is their grant submission deadline. So those were the things, both capital outlays as well as the additional requests we had submitted. And I look forward to answering your questions.
Thank you. Do we have some questions? Representative Saines.
Thank you. Thank you, Commissioner Ross. I have Kings Bay Naval Submarine Base in my district, and I have heavily utilized your department's assistance when constituents call, primarily to make sure they know that it's a resource, and every time that you do help, especially with navigating the federal process, they are tremendously thankful. So that work is much appreciated. With the Georgia Department of Veterans, or with the Georgia Veteran Service Foundation, understand other states have a similar concept. What is the current assets of the foundation? What is the board makeup of that foundation?
Thank you for that question. We have 7 board members. They were appointed last year when we had some change in legislation that allowed us to appoint new members. We have, I think we're sitting at $12,500, so we don't have a whole lot of money. They're just getting on board. They've met a couple of times, have identified priorities, but we really haven't had the ability to go out and fundraise yet for that foundation board. And so that's why we don't have a whole lot of resources, but of course a lot of needs. A lot of veterans come into us with needs. And the intent behind that board, just so y'all know, is not necessarily for us to be able to individually pay for somebody's, say, stay in a hotel or food or something like that. We've got tremendous community partners out there doing amazing things. They just could do more if they had the resources. So it would be through a sub-granting process through our Unitas platform, which would enable us to track all the outcome data.
And I know a lot of foundations utilize some of their assets to keep. They don't necessarily use that principal, but they use the interest of the principal to make those investments. Is that the concept of the $2 million, or is that for operational structure to develop a structure to be able to raise private funds?
Yeah, excellent question. I probably should have pointed that out. That was to use not the principal, but as an annuity, to be able to use what we would gain on the interest for that $2 million to then be able to invest it every year.
Thank you.
Madam Chairman.
Sorry, I think I've got the right number here. Representative Cameron.
Good afternoon, Commissioner.
Good afternoon.
Thanks for your presentation. Regarding homelessness, I'm in the northwest corner of the state. One of my American Legions is trying to tackle this by possibly building like small homes, tiny homes. Have you seen any of that in the state, any other area of the state where they're addressing homelessness like that?
Yes, sir. So there's quite a few areas of the state. Here in Atlanta, they're actually trying to build those out of containers. Central Georgia had small, tiny homes that I know they built about 3 years ago. And one of the latest ones that I got information on, it should be done later this year, is down in Brunswick. So a tiny home concept, some of them have community centers to have those resources kind of co-located, are popping up around the state, and at least my experience is they tend to fare pretty well. What that does is it enables that individual veteran to be able to have a home. What it doesn't necessarily deal with is, again, we have the largest number of female veterans in the nation here in this state, and often they come with children, and so it's not as conducive for a family. But yeah, great initiatives.
But it's good for like older veterans sometimes?
Yes, sir.
Yeah. Thank you.
Chairman Mathiat.
Commissioner,
Yes,
I
ma'am.
want to thank you publicly for helping my 101-year-old World War II veteran. It looks like everything's on go, and I just appreciate you so much for being Johnny on the spot with her, and thank you.
Yeah,
so
well, thank you
much.
for mentioning her in the joint appropriations hearing. Happy to help out. We were able to get a lot of things done, mainly through connections there with the Zebulon Clinic, so,
You were stellar, and I so appreciate.
yeah,
Thank
you are
you.
very welcome.
Thank you.
Are there any other questions from members? I'm not seeing lights right now. Let me ask you, one question that came up
Yes,
after
ma'am.
the hearing last week to me was just an estimate of how many burials are going on annually or sometime, and if you have to get back to us with that, that's fine, but just, how the cemeteries are doing.
Cemeteries are doing well. Burials have actually increased over the years. Russell probably has that off the top of his head. It's about 1,000 a year. What's the actual number?
About 600 a year, and that's in both combined, both of them combined. Excellent. Well, I'm glad we have that space for people. That is wonderful. And one other thing about what effect has the PACT Act had on benefit appeals and processing? How is that going?
Yeah, excellent question. Thank you for that. That has increased our workload, which is a good thing. There are so many more veterans who are now able to apply under the PACT Act. Again, that toxic exposure, whether the increase of presumptives for our Vietnam-era veterans or all of our Gulf War veterans. That's why we have been doing so many outreach events. We've been doing those in coordination with a lot of community partners where we bring a whole bunch of resources together to include us on the benefits side to be able to get folks to file. So more folks have been filing for PACT Act claims. Still, they're going a little bit slowly. We're starting to see some decisions by the U.S. Department of Veterans Affairs. But yeah, it's been a great thing, the most significant legislation, at least in my lifetime, for benefits. And so we're just hoping to help those through that process, because what tends to come to us in the appeals form is when somebody's tried to navigate it themselves, because it is complex.
Wonderful. Well, thank you for the work you're doing. I think we often forget how many people do come back to Georgia because they did some of their training here or had an experience or an educational time, beyond those who actually grew up here or had family members here. So thank you. It's so good to be in a state that cares this much. We appreciate you.
Absolutely, it is. Thank y'all.
And next, we'll hear from Director Chris Wells with the Georgia Vocational Rehabilitation Agency.
Good afternoon. I'm Chris Wells, the Executive Director for GVRA. First, I wanted to just take a few minutes to thank the Governor. Governor's office and their leadership over the last few years. We've been able to see a lot of progress at GVRA, and I know it's a lot of work in the leadership that we have in the Capitol. Definitely wanted to take this time to thank Ms. Stephanie Aponte. We had some training a few months ago with our focus on customer service, and she came down and had a really good discussion at Roosevelt Warm Springs with a lot of our staff about priorities there, and staff is still talking about training, so I just wanted to also say thank you there. Also want to thank the committee, the support that we've had over the last, like I say, couple years, seeing some of the work and seeing the leadership and seeing some of the things out in the field. Hopefully we'll be able to touch on it in the recommendation itself. And then just having the opportunity over the last year doing a lot of outreach and training. Our organization, we work very closely, and our staff works closely with DBHDD. So hearing Commissioner Tanner, Commissioner Brose, and that entire team, DCH, Economic Development, Department of Education, TCSG, GBA, I can go on and on, DOAS. We've been working behind the scenes with all of our partners to try to figure out how do we operate more efficiently and effectively, but also how do we serve. And so I wanted to take this time to thank all of our partners out there, as well as our board and our particular staff. Over the last couple of years, we've gone through a lot of adjustments, and we feel happy where we are. And I know it's because of a lot of the work that our staff is doing. And so wanted to take time, if we have our staff that's listening, just wanted to say thank you for the work that you're doing. First, again, GVRA, we're pretty much 5 budgeted programs. That's a lot here, and it's in your packet there. And our biggest program is VR. A lot of individuals that come across, they know a lot about vocational rehabilitation and some of the work that we do there, but we focus on individuals that may have barriers to employment, and we try to make sure that we eliminate those barriers and find employment itself. A little bit more about the agency. Again, here's our 5 budgeted programs. We're approximately about $190 million or $180 million. You can see the year-over-year expenditures here from FY23 and FY 2024. You'll see a slight uptick in expected expenditures due to the salary increases, and trying to essentially focus on how do we become better servants, better partners. And you'll hear me say a lot when we talk to our providers about how do we build that ecosystem. So we have a lot of supporters, and so we anticipate this year, as you'll see a little bit later on this slide presentation, of why you'll see that bigger jump in expectations for this upcoming year or this current year. To get right into the meat and potatoes of the program, of the presentation, our budget is pretty much flat. As you can see, we had a $1,000 pay increase, and again, that was seeing that come through at the end of December, as staff is calling, asking, is this true? And I'm saying, yes, let me check on it. So just, again, want to thank the General Assembly, want to thank the Governor's Office. That probably came at one of the best times of the year, as families and individuals were looking to celebrate. And so, as you can see here, our budget was fairly flat for AFY. The page 7 of your tracking document, you'll see 28.23.2. That's basically reducing some expenditures, and we'll talk about a little bit of what that touches on later on in a slide presentation. But again, our presentation was pretty much flat. This was able to cover most. Our disability adjudication services program is where we do our Social Security determinations. And so we've already reached out to our federal partners, even though we're in a continuous resolution, and they have been granted that $1,000 as well. So even though that's a federal program, we've been able to reach out and ask, and based on the approvals and based on the communication, our federal partners will be able to provide that $1,000 supplement there. That concludes the actual recommendations. We do have some additional slides on some of the previous appropriations that were provided, and kind of some updates on some of those things. But I'll pause for any questions if you have any.
Do we have any questions at this time?
Okay.
I don't see any.
This is my favorite part of the budget presentation. So here you can see some of our services coming out of the pandemic. We've been able to stabilize, but you'll see there on the blue chart, these are the students that we serve. We sit at the intersection of employment, education. There's a lot of things that GVRA does. And so federal funding in 2015 started to change. In 2020, they officially came in and they said, all VR agencies, we want you to focus on student services, student populations, working with your local school districts. And so GVRA made the effort during that time to start focusing on our pre-employment transition services and working in the schools. So you'll see here, this blue graph, this blue chart is where we're getting into schools and where we've pivoted a little bit to try to be more of a working partner with our Department of Education. You'll also see here, we did some case cleanups to try to make sure that our caseloads were manageable for our counselors. And so we're at that inflection point where you're going to see more and more services in that transition period for individuals that are coming out of school. We're taking the mindset, again, going back to being a high school teacher back in the day, of how do we catch individuals before they leave school. And so if we do a better job focusing there, the 100,000 students or so that have 504s or IEPs, those individuals are potentially eligible for VR services. So if we can get into the classrooms, catch them before they leave the classroom, hopefully that results in more referrals. It results in more VR individuals needing our services. And so that is the pivot that we have made. And again, further in the presentation, you'll see some of the results of that. Our next slide, and again, this goes back to some of the questions of how has the 7,000, the supplements from the governor's office, OPB, and the General Assembly has impacted GVRA. You can see the year before coming into the agency, kind of in the middle of the pandemic, as we've made a lot of operational adjustments. You can see where we were in 2019, where we currently are as of January, our median pay for our counselors, and then what our structure looks like, how we are strategic. And how we did this was, again, Veteran Services made a really good point. We started to focus on how do we serve more in the community by removing some of our physical locations, buying vehicles so we can meet clients where they are. One of the biggest struggles for the clients that we serve is transportation. So again, Georgia has 159 counties. We only had 40 field offices. Now we're down to a little bit under 30. And so you're not going to have, we don't have a location in every county. And so we were just strategic in being able to buy vehicles so we can meet individuals again where they are. And so this is an example of how we reinvested some of those cost savings over the last couple of years. Sound budget principles, working with our federal partners, understanding how we can make our federal grants do a little bit more with less. And so we were able to make some substantial investments, taking cues from the General Assembly as well as the governor's office. So this is an example of some of the adjustments and some of the changes. And then you'll see there the impact of turnover rates. And you can also see, again, in 2020, we were down to 86 counselors. Now we're up to 119, and we'll continuously have a hiring process itself. So that's a positive trend. And that's the leadership, again, Governor's Office, the General Assembly, and our partners over at OPB. Again, this is just a couple of the initiatives and a couple of the updates. Is one of the things when you get out in the community and you understand how do you serve, how do you do more, how do you serve. One of the things that we did is we looked at our 300-page client services manual, and we had a come to Jesus meeting. And we said, how do we look at this and how do we make sure that we're serving? And so we tried to eliminate any potential barrier that we were seeing in our policy that was resulting in us not being able to serve an individual. So I have Ms. Mamta Patel here. She's our Deputy Executive Director, one of the best financial minds that we have. And through her leadership, we started to look at, instead of having our counselors on the front line trying to manage resources from a economic perspective, how do we do that in the back office? So we adopted some better principles in the back office, took that pressure off a lot of our client and a lot of took some of those limitations out of our policy. And then we're just doing a better job of projecting, understanding how we can project out, how do we leverage federal funds. And so we're doing a better job of understanding what we have, what we don't have through sound budget principles, not necessarily through policy and procedure, because that can get very difficult. So we eliminate a lot of those policies and procedures that would have reduced. And one of the biggest ones was financial aid, financial needs assessment, which is bullet number 3. There were a lot of parents that would come in and needed some assistance. And we would ask W-2s, we would ask for a blood sample, we would ask for, or whether you wanted to donate to Oregon. We were asking for a lot of information just to serve. And so we tried to eliminate that. And so coming into January, and as we made that decision, we saw a lot of parents that were on that line of being able to serve, but maybe didn't have additional resources to be able to put their kids through school. And so through that elimination of their financial needs, I'm going to visit an individual hopefully on Saturday and have a conversation with that individual that is going to be going to Georgia Tech. And an example of removing that financial need is this individual needed a PCA to go to school 24/7. And so in working with Georgia Tech, working with that particular team and our counselors and removing our financial needs, that parent or that individual is now able to go to Georgia Tech. And now that individual is be able to have round-the-clock services, as well as having the resources in his dorm room to be able to make sure that he's taken care of. And so those were some of the direct results of just making some of the minor change. And then, as you can see here, the Bud McCall. Of course, I never met Mr. McCall until I got into this particular role, but I would always remember him talking about feral hogs when I was in my previous role. And so getting an opportunity to meet him, getting an opportunity to meet his family, and with Ms. Jane McCall on our board, had an opportunity to learn a lot. And we wanted to recognize him carrying the legislation for GVRA. And currently we do have what we call a Bud McCall post-secondary grant. And this is for any individual that may have a 504 or IEP that qualifies for VR services can come through our program and can get up to $17,000 towards tuition. We see the work of the General Assembly, we see the work of the governor's office, and for the individuals that we serve, we wanted to be a part of that conversation to be able to serve individuals and be able to provide that initial help. My wife works at Kennesaw State, and one of the things that happened that really touched me on this particular example here is there was a student that probably would have qualified for our particular services. And so when you're in the middle of that semester, life gets you a little bit, and then all of a sudden things starts to come down. I always think about that individual and say, man, if she was a GVRA client, we could have probably taken care of housing, we probably could have taken care of tuition. So whatever issues that individual had, because she probably would have qualified for our particular services, she could have been able to not worry about whether room and board is taken care of, or not worry about whether tuition is paid for, and she may have could have taken care of herself through other means. And so we think about that, and so part of these changes is designed to help us kind of move in that direction and get as many students working and running through VR, so when they go on college campuses, they have the resources that they need to be successful. And then you'll see here, even though we had a slight reduction of 403, some of that did touch on some of these particular initiatives that we have in place. Georgia Radio Reading Services, we increased that agreement to $400,000. And so again, part of this was how do you understand your federal funds? How do you understand how to leverage, again, really good team that makes me look good. So I'm very happy to sit up here and talk about all the great work that we're doing. But again, increasing, and so that allows us to work a different channel to serve individuals that are blind and low vision. I've been interviewed twice, so I'm finding out that I do like to speak. Centers for Independent Living, they do a lot of pre-voc rehab services, and being out in the community, we realize that a lot of people come to VR and they want the services that we offer, and we have to basically ask, do you want employment? Is that part of the goal? And a lot of individuals may walk through that door and say, I'm not ready for employment. And so it's kind of hard for our staff to say, well, VR is not right for you at this time. It has to be tied to job. It has to be tied to a career goal. And so what we try to do is leverage our partnership with the Centers of Independent Living to be able to offer some of those pre-voc rehab services. So hopefully we can send those individuals to our Centers of Independent Living, and then once they're ready for employment, then they can take advantage of the VR services itself. So we increased that, so it's a little bit over $2 million now. And then we established one counselor to the 9 centers that they meet each week. So again, if there's somebody that's interested in employment, we can help those individuals out. We've partnered with the Friends of Disabled Adults and Children, FODAC. Again, what are some of the things that we can't do as an agency, but maybe we can assist through other means? We increased our agreement to about $400,000 with FODAC to also take some pressure off our sales to be able to provide, like I say, durable medical equipment and assistant work technology. Again, our services are tied to if an individual wants and needs a job or trying to maintain their job, we can provide that service. But sometimes if they're looking for mobility services, our federal funding, which we rely heavily on, does not allow for that. And so how can we help facilitate those conversations? And so there are certain avenues and certain things and certain permissions that we can get to support other entities that may be able to provide that service. And so you can see some of the examples here. And then, of course, Blaze Sports. I'm a sports fan. I love sports. And so one of the things that I wanted to look at is who offers sports or can get into schools. And so we were able to expand our partnership with Blaze Sports to be able to work closely with Roosevelt Warm Springs, to be able to offer job exploration and different avenues to be able to work with students as they're looking for partnership and ways to get into their career goal. We have a relationship with Tommy Nobis Academy, and Dave Ward and his team doing a really good job. We went to them. They've established what they call an academy. So the individual is there for a year. They are offered various services to prepare them for employment. And for those individuals that are VR clients, we can support that entire program. Same thing with BDI. looking at ways to be able to provide training in cybersecurity. They offered up a certification program. Our funding allows us to pay for that particular program in its entirety, and so we've been working with them over the last 6 months to basically solidify so we can make sure that we are seeing individuals that may qualify for this particular program and moving. And then lastly, staff, reached out, our providers reached out and asked us to look at some what we call DIF awards, and these are just federal appropriations. Do we have the staff to be able to execute? Probably not, but we figured out we'll give it a shot, and just so happened that, like we say, you fail 100% of the time that they don't try. So we tried, we got the grant. So in October, we were awarded $10.5 million over the course of 5 years. And again, that's focused on working with the SEALs to go into local school systems to offer what we call soft skills trainings and some of those. And so that program is getting off the ground. And then we currently have a grant agreement that we received in 2022 of $3.3 million. And then just pivoting right quick, trying to make it fun. We're partnering with the Braves to try to provide opportunities for the individuals we serve to go to the Braves game. How are we being creative? This doesn't seem like VR or trying to get anybody in employment. You'll be surprised of how many jobs that the Braves offer behind the scenes. And so we wanted to take this opportunity to work with them to see hospitality. If sports is not your thing and you want to be tied to sports, how you can do that. We partnered with Ag Expo and also UGA, and looking at individuals that are interested in farming. We know Georgia is a big farming state, and so we were able to do a demonstration, invite Department of Education out, and realize we can do adaptive equipment. We can work closely to be able to move the needle on individuals that are still looking to farm, but they may need some adaptations to go with. And then lastly, working with our NFB, and then looking at some outreach related to some of our other providers. I'll conclude with our Roosevelt Warm Springs update. Over the last couple of years, we've made a lot of changes. And if you're looking at this, Mr. Metters, I didn't tell him that I was going to have his picture up here, but Chip is the individual that we had a random conversation on a Saturday and a random conversation on a Sunday, talking about the opportunity at Roosevelt Warm Springs. And so this is just a summary slide. We hired Chip in March of last year. He's an educator from the area. Has been doing some great things. We streamlined our programming. We're in the process of offering additional certifications programs. And so we did a complete 180 at Roosevelt Warm Springs. We were in the more in the clinical field. And so we wanted to look at ourselves as if we were a post-secondary institution. And so we made a lot of the changes. We hired educators. Chip hired 4 principals. We have Mr. Greg Teams, who's also an ex-superintendent that's in Polk County that's running our Cave Spring Center. And so that's a complete 180 of what we were doing. And so this is our commitment to serving our students and making sure we move the needle there. What is the impact of a lot of those changes? We have a CNA program, we have hospitality, we have low voltage wiring, we offer soft skills. Again, our picture of graduation, we have forklift training. We're into heavy equipment. We just bought over $500,000 worth of equipment through our federal partners, and so we're going to have some additional programs that are available there. This is Miss Annie Kim, who graduated this past year and is pursuing a career as an office assistant. And then based on those changes, as you can see, we made a lot of changes in FY 2023 coming out of COVID that really pivot to make sure we're a partner to DOE, make sure we're a partner to our local school systems, and just changing how we operate so we're not known for a clinical operation, but more like a post-secondary entity. And you can see there, we're serving 86 individuals in the dorm, but we also have educators that are there that are supporting that local community. So they have 10 contiguous counties that they support, and they've provided services to over 750 individuals, 758. So that is in 8 months. 8 months. And so we anticipate, based on the applications that we receive, to have more individuals. We're having conversations with various TCSG participating schools that are asking questions about individuals that may be coming on campus that may not be ready. They can come for 16 weeks and they can receive an industry recognized credential based on the high demand career clusters that we see at TCSG. And so this is an example of, again, the 180, but the progress that we've made in just 8 months. And then lastly, The General Assembly provided some additional funds in AFY. We were able to purchase a machine for paper cutting, and so we just took out the middleman. What was happening is we needed paper during the Great Recession to make folders. The same paper and equipment that we used during the Great Recession, during the pandemic, was the same equipment that was in the materials that was used for gowns and PPE. And so we tried to figure out how we cut that middleman out, and how we did that by purchasing our own machine. And so now we order our own paper, we cut our own paper to substantially save funds. This is actually accessible for individuals that we serve as well. So individuals that are blind and low vision can also operate this particular machine. And this is going to allow us to then turn around and now be a distributor of cut paper. And so we're happy about that. And as you can see, we are also looking at some other items as well. But this concludes our presentation. Like I said, had a lot of updates related to a lot of the recommendations and support of this committee, Governor's Office, as well as OPB. So just wanted to say thank you.
Thank you. Representative Anulowicz.
Yes, thank you. Thank you so much for all of this information. I wanted to ask about with the Bud McCall grants. Can those be used for students in IPSI programs and the inclusive post-secondary education programs?
So we currently support the IPSI programs. I think where we struggle a little bit with the IPSI programs is we currently provide $3,000, and I think we pay for room and board for the IPSI programs. I think what we would engage and would like to see as we continue to look at that is if some of the IPSI programs were offering a credential or certificate that's recognized, we can do a little bit more, but our federal funding limits us from being able to pay for auditing of courses. The courses have to go towards an actual degree or something like that. So we're very limited, but we do support our IPSI programs. Our maintenance does cover. We do give $3,000 a semester for the pre-eds piece, but or the soft skills piece. But we could do more if a lot of those courses were going towards some type of degree. We looked at Clemson. We have some students that go to Clemson. Clemson is on the cutting edge with their IPSI program, and they actually offer some type of hospitality certificate that's recognized. And so that could be a program that we would be able to offer the Bud McCall Scholarship towards, because that would be going towards a industry recognized program.
Thank you.
Mm-hmm.
Are there any other questions or comments? You got one, Representative Sainz.
Thank you. Commend you on the wait list reduction for the residential campus in terms of 18-month versus 0. Could you quickly describe, I know I've had constituents who've talked about it and it's far from our area. Is that a day program? Is it a
So it has gone through a transition. So we are a jobs and employment agency. We made a decision to work with the Georgia non-public post-secondary agency to be able to convert Cave Springs and Roosevelt Warm Springs into a non-public post-secondary. So the students that we are wanting to come in are students that may need those additional services. So it's kind of that niche is for our rural school districts that don't have CTAE programs, that they do dual enrollment because they need those extra services or assistance. We've modeled our program to be able to work with our rural schools, come for 16 weeks. We can teach you, we can provide extra tutoring for 16 weeks. One of our staff members that I went and he was teaching me how to do the forklift. He was like, Chris, when I was in the school, you know, I got 50 minutes with students, and with the individuals that may need some additional assistance because they may have an IEP or 504, it's difficult. But I got 5 hours, and he sounded like a military coach when he said, I have 5 hours with them. And so what happens is we're able to work with our school systems, especially our rural areas that may not have those programs or the means to be able to get them on campus, hopefully after graduation. And for 16 weeks, we can do high demand career cluster fields like CNA. We can do some of those services. So I wouldn't consider it a day program as you would traditionally equate to DBHDD. What I would say is it is a residential school that offers those additional life skills and life supports.
That's great, and I appreciate the clarification. In terms of, and I like the new, it sounds like the approach that allows for more use geographically, but in terms of the the consumers currently using it, is there a heavy geographic presence of one area of the state?
So there was,
others?
and that was one of the things that we're working on. So one of the things that we saw a lot of Metro Atlanta, and I think that was one of the critiques. What we have done, I am a country boy. Look up Rembrandt, South Carolina. You'll see 600 people, 800 cows. So my heart is rural, and so with Chip Metters, as you can see, he's from the area, so he's like a kindred spirit. We've been working, and he's been working to do tours, getting our rural school districts to understand what we offer. We can't prioritize, but we have to be statewide. But what we have done is we have strategically target our rural school systems because we know that they don't offer that particular service. So if you were to look at it, we're doing a better job of serving more individuals outside of Metro Atlanta, and that was part of our outreach and some of those things. And so if you were to look at it, it was probably Metro a year ago. I would probably say it's a little bit more spread out, but we can provide you that information as well.
Any other questions or comments from members? Not seeing any, I want to thank you. This is the best report we've had from GVRA as long as I've been here. So I just want to thank you, and thank you for where you are now getting, I would say, on the front end in so many places to really educate the educatable and to take that disability and create ability that enters our workforce. I think we're going to see some profound things from this. I look forward to it.
You will. Our board has been very supportive. Governor's office, OPB. I mean, again, I can go on for days. You would think, what does GVRA has to do with GBA? But with our infrastructure and a 900-acre campus with over 80 buildings that are older, being able to reach out to our partners at GBA and GISFIC and say, we need some help. We need to do this procurement. We need to get these buildings back online, and for them to pick up the phone. So we take great pride in those relationships, and I know from sitting in this particular role that it takes a strong team, it takes a strong staff, it takes supporters, stakeholders, it takes individuals that is willing to just take a conversation. So I've been such appreciative of the input and insight and individuals being able to provide some assistance. So thank you.
Wow. Thank you. Your creativity and commitment are showing, Director Wells.
Thank you so very much.
And next, we will hear from the Office of the Child Advocate, Director Jerry Bruce. Y'all know these hearings take a little long. They're filled with a lot of heart. Takes a little while. We've got a little bit more to go.
Good afternoon, Madam Chair, members of the committee. Thanks for allowing us to come and give what I hope will be a very short presentation. I'm not sure whether the Office of the Child Advocate is the smallest executive branch agency, but we've got to be in the running. So I hope this will be brief and uncontroversial for you. So the Office of the Child Advocate is an unusual executive branch agency, as you're probably aware, because it's an investigative agency rather than a service providing agency, although probably our second largest mandate is to provide education and system improvement to folks in our juvenile court system. So we do a lot of education as well as a lot of investigation, and we find that those two things really overlap. They both help us improve the system as we go. So we always like to remind folks of our statutory mandate. You've seen this before. You'll see it again in the next budget presentation, so I'm just going to slide over it, and if you have questions, I'm happy to come back to these. The main thing I would like to point out is that, as you can see, from 2020 forward, that our number of complaints has risen substantially, and if that's fiscal year 23 data, so it goes through the beginning of July, but if you can look at the next slide that has our calendar year data, you can see we're substantially up. So we went from just under 600 complaints in the last fiscal year to just over 600 in the most recent fiscal year, and then the calendar year was getting us close to 800. So we have a total staff of 9, including myself. So we're trying to respond to the challenges of increased complaints and with flexibility and sort of ingenious methods of addressing these problems. I would like to point out that I have the support today of Jen Carreras, our deputy director, and of Brenda Threlkill, our agency administrator. And so I think I can boast, unlike a lot of my colleagues in executive agencies, that a third of my staff are here today to support this proposal. So, and I want to thank them for help in putting this together. So you'll see this data again, probably in a little more detail the next time we're back again. So we provided it so that you can look at it and think about it. If you have questions, I'm happy to answer, but they don't bear directly on our amended budget requests, of which there are two. They're in 27.12 in the track sheet. The first one is, of course, the response to the $1,000 salary increase, for which we're very grateful from the governor's office and the support of the legislature for that. So that would enable us to implement that fully. The second one is a one-time request that we're making with the support of the governor's office to help us in the provision of quality legal representation for kids in foster care. I never get tired of saying, although I do get tired of having to say, I never get tired of saying that we really face a crisis of legal advocacy for especially the children in our dependency cases across the state. They are not being represented the way they ought to be represented. And we are working very hard to change that through principally a pilot project to help us use more effectively federal Social Security 4E funds to partially reimburse counties, not just to pay lawyers to sit in the courtroom, but to increase their training, the oversight of those lawyers, and the outcomes that they have. So we've had a pilot project in Chatham County that you all have heard about before. In the first year of that pilot project, where we oversaw 3 child attorneys who were dedicated and Chatham County provided for us, we saw a reduction in time in care from about 30 months to just under 20 months. That's a lot of money saved in foster care costs, sort of hidden costs that people are not aware of. And we've had so much interest in this program that we're rolling it out. We're starting in Gwinnett in this calendar year and in Troup counties as well. And we have several other counties lined up with requests to enroll in this program. We're providing the oversight for that. One of the things that we need to do in order to effectively demonstrate the usefulness of this program is to talk about how much money counties are currently spending on child representation or on parent representation, and look at how these pilot programs then impact the amount of money that counties are spending, and also knowing what the sort of there are several different ways in which juvenile courts across the state implement child and parent representation, and so we need to know how they're doing it now so that we can track how changes are made have long-term effects on that. As you've probably heard me talk about before, there's no way that we can access statewide data on a number of important measures for our juvenile courts. I don't have any way to get this information without basically hiring somebody to start calling county commissions, clerk's offices, juvenile courts, looking at records, looking at billing records, interviewing people. That's what this one-time enhancement is designed to support, our ability to get a project manager on this and to give us the baseline data on how counties and juvenile courts are doing right now with our current system of representation from a financial standpoint, so that we can come back and then meaningfully talk about the improvements that are made when we provide quality legal representation. We have a lot of information from studies in other states on the impact of quality legal representation on things like time spent in care, the facility with being able to wrap up an ongoing case without it dragging on so long, moving kids more quickly to adoption or other permanency options. We don't have a lot of information about the fiscal impact of those programs, and we want to be able to talk about that as well, because we know that's important too. So that's the rationale for our one-time request, to be able to gather that data so that we can provide a baseline for our quality legal representation program. So that's it for us. There's a little more information about this ask that's in these slides, but I'll open myself to any questions you may have now. And thank you very much for your attention to our requests.
Are there any questions or comments for Director Bruce? Not seeing any. I just want to thank you. I know you're been very patiently standing back there through all the presentations. So
That's all right.
thank you for that, and thank you for the work you're doing.
Thank you.
And I think you're going right to the heart of what we need to certainly
Thank you very
continue to
much.
work on.
Thank you, Madam Chair, and thank you,
Appreciate it.
members. We appreciate your time.
Okay, and now, from the Georgia Council on Developmental Disabilities, Director Darcy Robb. And after this, we did not do any sign up for public comment, but if there's anyone here who wishes to come, we'll just ask y'all to sort of come up in an orderly fashion and introduce yourself, and let us hear from you.
Okay. Hi there. I will be brief. Nice to be speaking with you all once again. Quickly nod to my staff. Harry Nelson is my fairly new deputy director in the back, and Star Bruner, of course, you all know, who does our inclusive post-secondary education. My public policy staff, Charlotte Densmore and Charlie Miller, are both under the weather today, so they cannot join us. Let's go ahead and get started. Okay, so in speaking about the amended fiscal 2024 today, so of course you all know that our mission here at GCDD is to bring about social and policy changes that promote opportunities for people with developmental disabilities and their families. And we look at that very broadly. We look at wanting people to live, learn, work, play, and worship in their communities across Georgia. So I always like to note here that the bulk of our funds are federal, a little over 70%. We are administratively attached to DBHDD, and we are governed by a council of members. And 60% of our members must be either individuals with a developmental disability or family members of folks with developmental disabilities. So looking here at the amended 2024 budget, and this is the bottom of page 18 on your tracking sheets, you can see that our additional item was, of course, the funds for the $1,000 salary bonus. And I want to say that that is noteworthy, and we are very grateful because here at GCDD, the bulk of our staff salaries are federally funded. So when it comes to looking at COLAs, our federally funded staff salaries, we actually do not receive those. And so I actually told my staff back in December, I'm sorry, but this is a quick turnaround, and I don't know if I'm going to be able to match these out of our federal funds. I know I can't give it to you yet. I was very pleasantly informed by our contact at OPB at the start of this year that good news, we did receive those bonus funds. So we want to express gratitude to the governor, to y'all in the General Assembly, and OPB for including my staff, who I would put up against any staff in the state of Georgia for their commitment and hard work. So, of course, in fiscal 2024, you all did see fit to give us an additional $200,000 for inclusive post-secondary education. And so if you look at our amended fiscal 24 budget, almost all of it, $741,350 does go to support inclusive post-secondary. So I have a quick update on IPSI, which I know is near and dear to the hearts of, I think, everyone on this committee. So, of course, inclusive post-secondary education, that gives students with intellectual disabilities the chance to attend college with their peers who may or may not have a disability. We have had IPSI grads for about a decade now, and 273 students have graduated from Georgia's IPSI program since 2013. In our most recent data, we are always proud to share our employment figures. 58% of IPSI students were employed within 90 days of completing their programs, which is very favorable when you look at individuals with similar disabilities here in Georgia. That employment rate is only 15% being employed. I do want to add a PS onto Director Wells's report, and I think there was a little bit of lack of clarity, which I certainly understand. He's got a lot to keep in his head. GVRA funds, while we're very grateful for the funding they do give, that actually does not pay for room and board. I want to make a note of that. Okay, so our IPSI programs, we have 9 options currently up and running and 130 students in this school year. You can see our stars. We have good representation across the state. And our big announcement here is that Berry College in Rome, our first private inclusive post-secondary program at a private school, will be opening in the fall of 2024. My last slide here. So in addition to the additional $200,000 that you all put into the budget for IPSI last session, there was another very exciting development. Actually, it was the very last bill passed by the House last session, and that was legislation that gave students access to state-funded IPSI grants. In the fall of 2023, you remember I said we had 130 students. Uptake has been very good. Namely, 125 students have received those IPSI grants. And it is important to note that the fund for those grants do not come through us at GCDD, which we support. They should not go through us. They go where, in my opinion, they need to go, which is through the Georgia Student Finance Commission. Those funds will also go through the Higher Education Appropriations Subcommittee. That is it for my presentation, but I am more than happy to take any questions.
Do we have any questions or comments from the committee? That was a great job, very informative. I know we want to dig into the GVRA funding that was mentioned and see what we can find out about it. So we'll do that too. I know y'all will, and get back to us as well.
Excellent. Yep, glad to have that conversation.
Thank you so much for all you're doing.
Thank you.
And so now we'll open up for public comment. If anyone would like to come forward, we'd love to hear from you. Just make sure to introduce yourself and thanks. Good. Give Mary Margaret and okay. There we go.
What do I have to do? Okay. Madam Chair, members of the committee, my name is Elizabeth Apley. I'm an attorney, and I'm here representing Georgia Advancing Communities Together, Presbyterians for a Better Georgia, 9 to 5 Georgia, the House ATL, the Georgia Supportive Housing Association, and Enterprise Community Partners Southeast on this issue. As you know, tonight culminates a week of some of the record lowest temperatures we've had in Georgia, maybe ever, but certainly in many years. And tonight is the start of the point in time count. I want to thank you, Madam Chair, for your question to Commissioner Tanner on the Georgia Housing Voucher Program, and that's what I'd like to discuss with you today. As you know, there's been a significant increase in homelessness this year across the nation. It's a 12% increase. In Georgia, it was a 15% increase. That was following a decade pre-COVID where Georgia saw tremendous decreases in the rate of homelessness. And as a result of this change post-COVID, last year Georgia was 8th in the country in unsheltered homelessness, with a rate of unsheltered homelessness of 52%, whereas in per capita homelessness we ranked 27th with a rate closer to 10%. So the cost of failing to safely house homeless people is enormous. We are paying for it in the cost of our emergency rooms, in our state hospitals, in our jails, and in our prisons, in the loss of human productivity, and as we saw even as most recently as Saturday night, the death of a homeless person in Atlanta who accidentally set himself afire in trying to stay warm under a bridge. The state auditor's report that was produced in response to Senate Bill 62 that passed last year did a good job of identifying the funding that the state invests in homelessness. And the audit report that came out just this month reflects that the only funds that Georgia spends on homelessness are the Georgia Housing Voucher Program administered by the Department of Behavioral Health and Developmental Disabilities, and the $3.2 million allocated through the State Housing Trust Fund for the Homeless. The vast majority of funds come from the federal government. So as you know, the Georgia Housing Voucher Program, as Commissioner Tanner reminded us, is nationally recognized for its excellence. The program was established under the settlement agreement with the Department of Justice 12 years ago in order to provide housing for homeless people with mental illness who are cycling through the criminal justice system, the state hospitals, and the emergency rooms. So this is that chronically homeless, largely unsheltered population. The target population identified in the settlement agreement was to serve 9,000 people. The most recent report that we have from the department on this was very recent, that there were 2,549 people being served as of January of this year. This is a dramatic increase. We had a 27.4% increase in the people we served in FY23, and the program continues to refer, to serve, to provide housing, and to keep stably housed a dramatically increasing number of people. But during FY23, the number of people leased up or entering the program successfully each month doubled. And so we thank this committee that has been critical in helping to restore funding. You'll recall that at the outset of the pandemic, when most of our agencies were cut 10%, this program received a cut of over 24%. And so in FY23, you all helped to restore $3.38 million and another increase of $1.9 million last year. Thank you. That was initially part of the governor's language disregard, but he subsequently lifted that, we understand, in October, and that funding was received. Even with those increases that we're very grateful for your leadership in providing, the department is still $1 million short of where it was in FY20. So the current appropriation for this program is fully utilized. The number of people being served is dramatically increasing, and the cost of providing housing and support is dramatically increasing. Since the start of FY 2024, 429 people have entered the program, with a projection that more than 900 more people will be served during this FY 24 fiscal year. So additional funding is needed to cover them. You heard Commissioner Tanner. If these people are referred and they're eligible from prisons, from hospitals, from jail, from emergency rooms, they are mandated to serve them. And he said they're going to need more money. At the same time that we have more people coming into the program, the price of rent for this program, as for everyone else across the state, is increasing dramatically. There was a 20% increase in the cost of the subsidy in FY23, and there's been an additional 10% increase just in the first half of FY24. The bridge costs have also gone up dramatically. This is substantially those startup costs, the initial months of rent that are required by landlord to get people into the program. But we also want to brag that they have brought down the cost of these very critical housing support teams that help people get connected once they're qualified with an apartment that they can lease, and also continue to serve them to help keep them stably housed, to help keep them in that housing, connecting them to services, negotiating with the landlord, et cetera. So the need is for an increase of $11.8 million in the FY24 amended. And the second page reflects not only a breakdown of how that money was calculated based on department data, but also the various voices within this gold dome that are calling for increased funding for supportive housing, for housing the people, the familiar faces who are cycling through the criminal justice system, from the Behavioral Health Reform and Innovation Commission, from the Senate Study Committee on Unsheltered Homelessness, from the department's SHARE Committee, which I now chair. This is the Supportive Housing Advisory Committee that brings together all of the agencies and the advocates and the lawyers who are the experts on this issue. And from ACCG saying, you know, we are paying the price of holding these people in jail, of their unmet need results in a tremendous burden to the county. So this is an excellent program. We thank you for your past support. I know I've given you a lot of numbers, but we wanted to be sure that you understood that this was a number that was based on the best research available.
Thank you, Elizabeth. Are there any questions or comments from the committee? I just had one. How many nights is the count? It starts tonight, I think you said. Is it
in
5
Atlanta,
nights? Is it?
It's a week. Atlanta is starting tonight. Some of the other communities are starting during the week.
Okay. And it continues, the count continues?
For a week, I believe, yes. And the
So is that like
experts
a
on it are
7-day?
unable to be here because they're managing the count.
Is
Yeah.
it like a whole 7-day week, or is it just 5 nights, or do you know? I don't know, I'm just curious.
I've got the article in my briefcase, and
It's
I'll.
okay. You can text it to me
Yeah,
sometime.
I will text it to
That'll
you.
be great.
You know, yes, they do their
Thank
very
you.
best
And
to
that is
collect.
happening all over the nation, right? Today?
Yes,
Yeah, this is it.
absolutely. It's federally required. And that will determine the effectiveness of our ability to count people, whether they're in emergency shelter or out on the street, is going to determine how much federal funding we get, and that's the bulk of it. But we need this state funding in order to meet what Commissioner Tanner tells us is absolutely essential to meet our obligations under the agreement.
Thank you.
Thank you.
Thank you. Okay, I think we have another speaker.
Good afternoon, one of the other usual suspects. I'm Stan Jones with the Nelson Mullins Law Firm, a lawyer lobbyist. I'm here to speak for Partners for Homes, so that's the nonprofit continuum of care agency that is doing the count tonight and also developing additional housing resources. And we really appreciate the case management dollars that this committee provided in 23 and 24, 23 amended and 24. We'll want to talk to you about continuing that in 25. It was labeled one time and did not make the governor's budget, but it is the activity of having the people who go out to the street and talk to folks who are living in the tents and say, we would like you to choose to come in, and we are building resources for you. I wanted to say today that on Friday, the Partners for Home is opening a new interesting project called The Melody, and it's named for one of the women who died on the street a year ago. And it's very close to here. It's 5 blocks on Forsyth Street. At 11 a.m., we're opening the project. We have a ribbon cutting. We'd love for any of you who are interested to come. I know we'll understand the floor schedule later in the week. But it takes the GEMA trailers that were provided to hospitals for backup during COVID and turning them into housing units. So with kitchens, sewer, doors and windows, there are 40 units being installed over here on Forsyth Street. It's right next door to the Greyhound bus station and the MARTA Garnett Street station. We'd love for you to come see it. We do want to talk to you about some operating funds for it and some mental health services. I have some of that information now. I'll bring it to you in the next day or two, as y'all, I know everything's moving fast. We completely support everything that Elizabeth said so eloquently. You know, housing vouchers are key. They were disregarded. Some of them got restored in the fall, but the demand, as she can tell from her, is larger than what you appropriated last year and what has been restored. And so that's actually the technique that allows people like Partners and its subcontractors to rent property and get people into safer, protected places to live. And I'll say too, there is also, this is a one-time opportunity that may fit best and amended. There's another piece of property that the city of Atlanta has swapped with the Atlanta school system. It's right on I-20 West, about the third exit from the connector. It's called Cooper Street. There's enough room for 500 people to live there, and the first 150 modular housing units are available to be commenced. And that's a large item. It's $4.7 million. I mention it now because this appears to be in the amended budget when we have the opportunity for, one-time larger asks like that. It could fit in this committee. It could fit, under DCA as the Housing Trust Fund comes up. And this is the first year that there's new money in the Housing Trust Fund to match the dollars for the youth homelessness project. And then in the 25 budget, there's additional funds for other types of homeless services. So this is a unique year. It fits well with the legislature, the governor's incredible interest in developing housing that emerged last year around the Rivian and Hyundai plants, and it's starting to grow. So you've got some big ads in DCA, some big ads in DOT, and some opportunities, I suspect, without knowing all the details, those on the outside we don't, to do some really special things in the next week or two as you deal with the amended budget. So I'll have some more detail about Cooper Street and the Melody on Forsyth Street, but we would love you to come Friday morning. If the house finishes up, I'll help you get over there. And one reason I wanted to mention it, because this reflects the kind of innovation that the discussion around Senate Bill 62 got to when Chairman Dempsey, and Senator Summers on the Senate side said we need to do more, and there's some ways to do that. And so I like the Melody, Cooper Street. They won't be new tent cities, but they will be places with, warm places to live with kitchens and bathrooms. And so all the things that y'all inspired last year from the discussions over a couple of years are coming to fruition. And we readily understand as an Atlanta agency that things need to be statewide also. So I'm just talking about some things that are kind of shovel ready, if you will, to use the term that's been popular last week. And I'd love to have you see them, and we'll be talking to you about them the next couple of days. Thank you.
Wonderful. Thank you so much. Are there any other question? Wait, Sam, I think we have a comment or a question for you here in just a minute.
Sure.
Chairman.
Thank you so much for your information. I have two questions.
Sure.
Permanency on Cooper Street and Forsyth, those homes will be there forever and ever?
Well, they are, but they're made for people to come off the street immediately for a few months, and then you move with a voucher, into an apartment. So Partners Homes also bought a motel on Moreland Avenue, and it's in DeKalb, but in the city of Atlanta. There's about 60 units, turning that into essentially efficiency apartments. So, the vouchers supply the rent for the developers for things like that. This is all kind of interconnected. So it's like a path to permanency is a better way to describe, the use of the trailers or the modular units.
Gotcha. Now I have two more questions. I
Sure.
thought I only had one. Okay,
I
so
can talk forever.
will that be open to veterans as well?
Yes, absolutely.
Okay, and then the count tonight, that's across the state?
Well, it's required to be done this week by each of the continuum of care agencies. So the bigger counties have their own continuum of care agency, and then there's one that's called Rest of State. So each of them is required by federal law to do the count during this week. So the Atlanta one happens to be tonight. It actually is going to go on, I think, 3 nights because it takes some time to get around.
Sure.
I think the article in the paper said that one other county starts tomorrow and one on Wednesday.
So they will count in the homeless shelters as
They go to the shelters
everywhere.
and the streets. It's both. That's why it takes some time. You know, shelters are sort of easier. And I'll say what y'all supported last year was the caseworkers to go persuade people to come inside. I mean, that's a hard job. You got to establish trust. Some of these are communities where people, they've been living there for a while. They protect their territory and their property. And it's a persuasion, you know, to get off the street. We all want that to happen, but it's not a simple thing.
I understand that. Thank you.
Sure.
I think that's it. Thank you. And thank all of you for hanging in here. We are adjourned.